To Lebanon now, where health workers have launched a two-day strike over banking restrictions, which they say are pushing the healthcare system to the brink of collapse. The Union of Private Hospital Owners has said health centres participating in the strike would only allow emergency cases and dialysis patients. Workers have staged a protest outside the central bank in Beirut as the value of the local currency continues its slide against the dollar. Well, joining me now from Beirut is Suleiman Haround, who is the head of Lebanon's Private Hospitals Union that I mentioned there. Thank you for joining us. One wonders that Lebanon has had a lot of political instability, mainly over the economic crisis there and the management of the country. Elections have only been staged there very recently. Wouldn't it have been better just to have given the new people in charge a bit more time to try and sort things like these out, rather than put people's lives at risk?
No, we're not putting people's life at risk because we're covering all emergencies and all critical cases. Now, regarding new people getting elected, not too many of them actually are new. So we don't expect that there will be a big change from what it was before.
So what difference would the strike action make then, if you have no faith in politicians right now?
Well, it's a way of saying that enough is enough and we cannot continue like this. What triggered the last crisis is something very peculiar. I don't know if it happened in any other country. Banks stopped to give us our money to pay the suppliers for medical supplies and drugs. And therefore, it kind of brought the hospitals to a halt because the suppliers wouldn't provide us with the supplies if we don't pay them in cash. And the banks don't give us the cash from our own accounts. So that triggered the problem. And we're trying to solve this through the Central Bank of Lebanon, because the banks, the commercial banks, say that these instructions came from the Bank of Lebanon. So yesterday it was a strike basically directed towards the Bank of Lebanon to lift these conditions that have put on the commercial banks, that is not providing the hospitals with the necessary cash to do their business.
Nobody ever would think that doctors or nurses would go on strike action unless they felt that was the last resort. I think everybody appreciates that. Can you give us some insight, though, into just how crippling it is now to do your work in hospitals and to treat people?
It's very difficult, actually. The hospital sector is facing a huge problem now. We have lack in drugs, we have lack in shortages in medical supplies. We are losing the human resources. The best of doctors and nurses and workers in the hospitals are going abroad, and I think that they're not returning back. So there is a hemorrhage, actually, of human resources. And at the same time, we're facing financial difficulties like all the sectors in Lebanon because of the financial situation in general. And therefore, lots of people in Lebanon now cannot afford going into a hospital and paying the bill. And this is a catastrophic situation that has never been like this in Lebanon. You know, Lebanon was living quite normally with the hospital sector running smoothly. Healthcare was available to all the population. In the last 2.5 years, everything has changed and the system has collapsed, definitely.
Suleiman, many thanks for taking the time out to talk to us. Suleiman Haround there from Lebanon's Private Hospitals.